Hi everyone, I'm Dr. Charmaine Johnson from Premier Smile Center, and today I'm going to talk about a question that comes up all the time. Why do I need a crown? Is the dentist trying to rip me off? And I'm going to let you know about why most scenarios you would need a crown. So basically, sometimes when teeth have large fillings on them, so imagine this is your tooth, it's got a large filling, you just got a shell of tooth around it. What happens is that shell is very weak, so if you bite down on anything, it might break the shell and it'll break your tooth. So that's one situation where you would need a crown. The second situation would be if your tooth is broken, and to fill it and patch it would take too large a filling to be able to put in place. The third reason why would be if you have lots of cracks and fractures on your teeth, and if you bit down on it, it would break. And then lastly, on your back teeth, after you've had a root canal, we like to put a crown on it because it protects the tooth, prevents it from breaking after everything you've done to try and save that tooth. A crown takes 2 appointments. The first appointment is when we prepare the tooth for a crown. We take a scan or an impression of it. Then we put a temporary crown on top. And then the second appointment, you would come back, we'd replace the temporary crown with a permanent porcelain crown on top. And then you are perfectly fine. Is there any special maintenance with a crown? The answer is no. A crown should basically be treated just like your own tooth. So you should brush, floss, water pick, do everything like you would normally do for the rest of the teeth. And then lastly, how long does a crown last for? A crown itself can last you for many, many years. 10, 15, 20 years. I have patients with crowns for that long. The problem comes when you get a cavity on the tooth that the crown sits on. So when you hear crowns that don't last, it's not the crown itself that's not lasting. What happens is if this is your tooth and you put a crown on top, this margin here where the crown and the tooth meet each other, if you get decay on the tooth here, it eats into the tooth and gets underneath the crown, and then either the crown falls off or you have pain and you have to replace the crown. So if you take care of it just like you would with your own natural teeth, and you make sure that there's no plaque and bacteria around the margin of that crown, then it can last you for a very, very long time. So I hope that helps with any of your questions. If you have any further questions, please give us a call at 954-566-7479.